Hi, I'm Mike from Untitled Medical. Today we're going to talk about the Daniel Baird Foundation Emergency Bleed Control Kit. As with all emergencies, the number one thing is to take care of yourself. You shouldn't go into a dangerous environment. You need to kind of check the area is safe before you go and help a patient. It's also really important to remember to call 999 and make sure you've got a paramedic coming to back you up. So the first thing we're going to do in any emergency is to check the danger, make sure it's safe for us, and then we're going to consider our own safety and that of the casualty. We're going to stick a pair of gloves on. So the gloves come in a kind of recyclable paper bag. It's all sterile. These are kind of a medium to large fit, so they're designed to fit the majority of people, and they are latex free, so they should be safe for people to wear. And now we're ready to treat a patient. The vented chest seal is a real critical component in any trauma kit. It's designed for any kind of chest wound where there's a puncture to the lung cavity. The risk here is that air gets into the lung cavity and it actually crushes the lungs, and that basically suffocates the casualty. What this chest seal does is it seals the hole, and then it's got lots of really small vents on it, and that will allow the air back out of the lung cavity. So as the lungs are trying to inflate, the air can escape, but then as the lungs deflate, as the person breathes, new air isn't sucked into the lung cavity. So on our mannequin here, we've got a fake wound to show the kind of wound that it could be used for. This is the chest seal. We use a Fox seal vented chest seal. So it's got both top and bottom two nice easy tear points to make it very easy to open. These are all obviously fully sealed. Inside you've got a protective layer over the chest seal, and so this can be opened up to remove the chest seal. There we go. So the adhesive side goes down. Ideally the centre can go over the hole, but it will work. And then all of these little sections you can see around here, these are all the little vents. So that has now sealed the hole. This casualty will be able to breathe, and as they're trying to breathe you'd see this flapping up and down slightly, and the air can escape through all of these tiny little pockets, but as they breathe in you'd see that suck in and seal up the hole. More information about all of these kits can be seen on our YouTube channels, on our social media, and they can be purchased from our website, turtlemedical.co.uk.